All right, so since Senator Bates is, I think, still occupied with her other committee, we'll go ahead and move to item number 1, SB 24 by Senator Leyva.
Thank you.
Welcome.
Good afternoon, Mr. Chair and members. I would first like to thank you, Mr. Chair, and the committee members for your hard work on this important bill. Much appreciated, and I will be accepting the committee amendments, the proposed amendments. Members, as many of you may remember, several of you saw a similar version of this bill last year, SB 320. Unfortunately, after passing both houses, former Governor Brown vetoed this important legislation, saying that students having to travel a good distance off campus to access medication abortion is not unreasonable. As a woman and as a legislator that strongly believes in the constitutionally protected right to access abortion, I both respectfully and profoundly disagree. As I have said many times before, this issue is so important for countless UC and CSU students that I will not rest until it becomes law in California. Members, SB 24 would require all on-campus student health centers at public universities to provide medication for early pregnancy termination for their students by January 1st, 2023. According to the Guttmacher Institute, since 2000, over 1.5 million women in the United States have terminated early pregnancies through the use of medication abortion. In 2014, women aged 20 to 24 accounted for 34% of abortions, the largest for any age group. Medication abortion is a two-step process where a patient takes 2 sets of pills over the course of 2 days during the first 10 weeks of pregnancy. According to a UC San Francisco study, medication abortion is very safe, with major complications occurring in only 0.3% of cases, which is less than Tylenol and Viagra. In a moment, you will hear more from Daniel Grossman, a clinical public health researcher on abortion and contraception, who will further discuss some of this important research. Though many California public universities already offer reproductive health care services, such as pregnancy options counseling and contraceptives, none currently offer access to medication abortion on campus. Medication abortion is a safe procedure and is clinically simpler than much of the care already offered at college student health centers, such as diabetes management, mental health care, and diagnosis/treatment of sexually transmitted diseases. If a student has to go off campus to find a provider that does not accept their student or other private health insurance, paying for medication abortion may be a significant financial burden. In total, 22 UC and CSU campuses are more than 30 minutes away from the closest abortion provider via public transportation. This care requires 2 trips to a health clinic, meaning 2 hours of total travel time. These barriers are worsened since only 15% of the closest off-campus abortion providers are open on weekends, meaning that students may have to miss class, miss exams, and work to access abortion, which the Supreme Court has determined to be a protected constitutional right. Being able to access medication abortion on college campuses is critical, since women must receive this care within the first 10 weeks of pregnancy. And most women don't even know that they're pregnant until the 5th or 6th week of pregnancy. Members, the right to choose isn't just a slogan, but rather a commitment to improving the true access to abortion for Californians across our state, including college students at UCs and CSUs. With me here today to speak in support is Dr. Daniel Grossman, Professor and Director of Advancing New Standards and Reproductive Health at UC San Francisco, and Jesse Rosales, a recent graduate of UC Riverside. I will defer to my witnesses, Mr. Chair.
All right, thank you, Senator Leyva. Witness support between the two of you, 6 minutes. Thank you.
Thank you very much for the opportunity to speak to the committee today. As Senator Leyva mentioned, I direct Advancing New Standards in Reproductive Health at the University of California, San Francisco, and we've published 2 studies in peer-reviewed journals related to the College Student Right to Access Act. The first looked at how often students seek abortion care and whether they face significant barriers. Students across the 34 UC and CSU campuses obtain approximately 1,038 abortions each month. We estimate that as many as 322 to 519 medication abortions would be provided monthly on campuses if student health centers offered this service. We also found that across all public university campuses, considering that the service requires 2 visits, the median time by public transport to the closest provider is an average of 2 hours round trip for medication abortion and up to 4 hours for students on some campuses. Many students have limited financial resources, do not have a car on campus, and must rely on public transport in order to get to these visits. According to the California Code of Regulations, traveling more than 30 minutes for health care renders that care inaccessible. Given these findings, I believe that abortion care on campus is necessary to improve access and decrease barriers for students. For the second study, we studied the capacity of student health centers to provide medication abortion on campus and what they would need in order to provide this service. All UC and CSU student health centers already offer reproductive health services. They employ or contract with at least one physician and or advanced practice clinician. They have the needed physical space in order to provide the service. In order to be able to offer these services, they would all need training. They need an ultrasound machine if that's needed to determine the gestational age to date the pregnancies. Some of them would need 24-hour telephone support to triage services if that's not already available. Taking our research into account, along with what Senator Leyva already said about how medication abortion has been clearly proven to be safe and effective and clinically simple to provide, I believe that with the funding that has been committed, it would be very feasible to offer medication abortion at student health centers. There's really no reason I see to exclude medication abortion from the services that are already provided at the student health center. Thank you very much, and I'm happy to answer any questions.
Thank you to the chair and the committee for having me today. My name is Jessie Rosales, and I am a campus coordinator with the Just Care campaign at the Women's Foundation of California. The Just Care campaign mobilizes students to expand reproductive equity on California public universities. This includes lifting barriers to abortion care. Senate Bill 24 is deeply personal to me. Every month, as Dr. Grossman already shared, hundreds of California college students are forced to leave their campuses for abortion care that they should be able to get at the on-campus student health centers. Just 2 years ago, I was one of these students. In my 3rd year at UC Riverside, I discovered I was pregnant. As my doctor at my student health center went over my options, I knew that I wanted to get an abortion. Because I couldn't get my abortion at my student health center, I was forced to navigate cumbersome, confusing referrals to off-site clinics that ultimately delayed my care for 3 months, during which it became increasingly more difficult to live my life. As a woman of color, child of immigrants, and low-income student, I did not understand what it would be like to navigate the medical system or insurance policies. I didn't have the resources to get the care I needed off campus, such as money and a car. And this is just my story. Once a student has decided to end a pregnancy, they shouldn't be forced to go off campus to see a provider they don't know, where care can easily be provided on their campuses. Leaving campus can mean taking away time from class, an internship, family time, or your job. It can be hard to raise the money or find reliable transportation to a faraway clinic. Offering abortion care on campus helps to ensure these services are available to all students who might need them, and it is an important step toward achieving true reproductive justice and equity for California college students. Thank you.
Thank you. Thanks very much. All right. Witnesses support at the back microphone. Please give your name, your organization, and I assume if you're on the line right now, you are in support, but you can go ahead and say that. Welcome.
Chairman, members, Roxanne Gould, representing the American Nurses Association of California, in strong support.
Thank you.
Lydia Bourne, representing American Academy of Pediatrics, California Division, in support.
Thank you.
Hi, Angie Minetti, representing Planned Parenthood, in support.
Thank you.
Mr. Chair and Member Sylvia Solis-Shaw, on behalf of the over 28,000 members of the California Faculty Association, in strong support.
Thank you.
Magali Zagal with the American Association of University of Women, in support.
Thank you.
Amaris LeBron of the League of Women Voters of California, in strong support.
Thank you.
Jen Flora on behalf of Western Center on Law and Poverty, in support.
Thank you.
Karen Humphrey, National Women's Political Caucus of California, in strong support.
Thank you.
Ryan Spencer, American College of OBGYNs, District 9, in support.
Thank you.
Megan Allred on behalf of the California Medical Association, in support.
Thank you.
Sarah Yang, UC Davis medical student, in strong support.
Thank you.
Molly Colton with Sierra Club California. We support this bill and urge an aye vote. Thank you.
Thank you.
Good afternoon. My name is Olivia Hansen. I'm a student at UC Berkeley, and I stand with Students United for Reproductive Justice, the founders of this bill, and I'm in strong support. Thank you.
Hi, I'm Ava Davis, a recent graduate of UC Berkeley and member of Students United for Reproductive Justice, in strong support of this bill.
Thank you.
I'm Yavzin Gami, a student at UC Berkeley and with Students United for Reproductive Justice, and I'm in strong support of this bill.
Thank you.
Catherine Fennell of UC Berkeley, in strong support of the bill.
Thank you.
Sloan Seal, student at Sac State from the Central Valley with ACT for Women and Girls, in strong support.
Thank you.
Hi, my name is Ruth Sosa. I go to Sac State. I'm from Tulare County. I'm with ACT for Women and Girls as well, and I'm in strong support of the bill.
Thank you.
Hello, my name is Rosalinda Guzman. I'm from Visalia, California, Tulare County. I support this bill, and I'm here with ACT for Women and Girls.
Thank you.
Hi, Sarah Hutchinson with ACT for Women and Girls, a co-sponsor and in strong support.
Thank you.
Dr. Matulich, OBGYN abortion provider at UC Davis, in strong support.
Thank you.
Hi, my name is Noelle Jones. I'm a student co-sponsor representing Students United for Reproductive Justice, and I urge you to vote aye on this bill.
Thank you.
Hi, my name is Daisy, third-year medical student at UC Davis, and also in strong support.
Thank you.
Kevin Mortazavi, medical student at UC Davis, in strong support.
Thank you.
Diana Hoff, fourth-year medical student, UC Davis, strong support.
Thank you.
I'm Hilaria Barajas, a graduate of UC Santa Cruz and a part of Access Women's Health Justice, and I am a strong supporter.
Thank you.
Rachel Coe with Access Women's Health Justice, co-sponsor. We urge your aye vote.
Thank you.
Puneet Puriwal on behalf of Equality California. We support this bill.
Thank you.
Kathleen Singh, graduate of UC Berkeley, and I strongly support this bill.
Thank you.
Marisol Franco with California Latinas for Reproductive Justice, proud co-sponsor and strong support.
Thank you.
Phillida Burlingame with the ACLU of California, co-sponsor and strong support.
Thank you.
Sheila Tai, resident physician at UC Davis Family Medical Center and also a UCLA grad, in strong support.
Thank you.
Marissa Gonzalez on behalf of the National Association of Social Workers, in strong support.
Weslina Hung with IFWIN How, the Reproductive Justice Association at UC Davis School of Law, in strong support.
Thank you.
Rachel Ng with University of California, Santa Barbara AS Human Rights Board, in strong support.
Thank you.
Vicki Wei, I'm a student at UC Santa Barbara and in strong support.
Thank you.
Hi there, Grace Pang from San Jose State University, and in strong support. Thank you.
Thank you.
Libby Benedict, proud UCLA Bruin, class of 76, in strong support.
Thank you.
Tiffany Dang, student at UC Santa Barbara, in strong support.
Thank you.
Phoebe Abramowitz with Students United for Reproductive Justice at Berkeley, co-sponsor and strong support.
Thank you.
Frank Hernandez, student at Mills College, in strong support.
Thank you.
Felipa Villalobos, student at UC Santa Barbara, in strong support.
Thank you.
Liz Jacobson, student at UC Davis, in strong support.
Thank you.
I'm Shabira Rojas. I'm a student at UC Davis, and I'm in strong support.
Thank you.
Hi, I'm Savannah Ryder. I'm a student at UC Davis, and I strongly support this bill.
Thank you.
McKenna Marty, medical student at California North State University and alumni of Cal Poly SLO and UC Davis, in strong support.
Thank you.
Hi, my name is Sonia Goch Avila. I'm a graduate of UC Santa Cruz, and I'm in strong support.
Thank you.
Hi, my name is Kevin Minaj Edwin Chikuka, and I'm a student at the University of California, Santa Barbara, and I'm in strong support.
Thank you.
Tom Steele, co-chair of UCSB Lobby Corps, in strong support.
Thank you.
Emma Warshaw, student at UC Davis and founder of the Students for Reproductive Freedom, in very strong support.
Thank you.
Meg Winnett, Human Rights Board at UC Santa Barbara, in strong support.
Thank you.
Lauren Lowe with Students for Reproductive Freedom at UC Davis, in strong support.
Thank you.
Teresa Roman from UC Santa Barbara, and in strong support.
Thank you.
Emily Montalvo Telford from UC Santa Barbara and Students Against Sexual Assault, and I'm in strong support.
Thank you.
Daisy Ariana, UC Santa Cruz grad, in strong support.
Zoe Murray, student of UC Santa Barbara and also part of
Planned Parenthood Generation Action, and strong support.
Thank you.
Gabriella Waltz, part of Students for Reproductive Justice at UCSB, in strong support.
Thank you.
Lena Mallett with Students for Reproductive Justice at UC Santa Barbara, and I'm in strong support.
Thank you.
I'm Reverend Elizabeth Griswold, ordained Christian minister with Parkside Community Church, United Church of Christ. Also a UCLA grad in 2000, and someone who has used this medication, and I'm in strong support.
Thank you.
Jasper Conacher with the Feminist Majority Foundation and future UC student in strong support.
Elizabeth Kavianian with Planned Parenthood Generation Action at UC Riverside, and we're in strong support.
Thank you.
Isabella Bautista from UC Santa Barbara with the Human Rights Board and Students for Reproductive Justice.
Thank you.
Sophia Manju, student from University of California, Riverside, and a part of Planned Parenthood Generation Action, and I strongly support this bill.
Thank you.
My name is Erica Casey. I'm a student at UC Berkeley, and I strongly support this bill.
Thank you.
Emily Escobar with the Feminist Majority Foundation and recent Cal State Long Beach graduate, and I strongly support this bill.
Thank you.
Melissa Tribble, UC Davis law student, former UC Santa Cruz student, and part of If, When, How Law Students for Reproductive Justice at UC Davis. I support this bill.
Thank you.
Bianca Arias, UC Riverside student. I support this bill.
Thank you.
Hi, my name is Afra Youssef, and I'm a UC Berkeley student, a part of the Sexual Violence Commission, and I strongly support this bill.
Thank you.
Hi, I'm Emma Aguayo, here with Students United for Reproductive Justice at UC Berkeley, and I support this bill.
Thank you.
Hi, I'm Christina Cheng with Students for Reproductive Justice at UC Santa Barbara, and I support this bill.
Thank you.
Hi, my name is Hannah Hill, and I'm a student at UC Berkeley, and I'm in strong support of this bill. Thank you.
Thank you.
Hi there, Amber Avila from San Diego State University, in strong support. Thank you.
Thank you.
Hello, Giselle Vasquez from UC Berkeley, and I strongly support this bill.
Thank you.
Angel Huerta with Planned Parenthood Generation Action at Riverside, and I strongly support.
Thank you.
Tiffany Lee, a student at UC Riverside, also part of Planned Parenthood Planned Generation, and I support this bill.
Thank you.
Kelly Beam on behalf of myself, and now I'm dating myself, class of 03, in support.
Thank you.
Hi, Shannon Hovis, NARAL Pro-Choice California. We are a co-sponsor on the bill, strongly in support.
Thank you.
Linda Tenerowitz on behalf of the California Pan-Ethnic Health Network in support.
Thank you.
Hi, Bia Vieira with the Women's Foundation of California, sponsor of the bill, in strong support.
Thank you.
Marge Plum, representing the funders for SB 24, strong support.
Thank you. Okay, seeing no one else at the microphone, witnesses in opposition. If you want to come up to the table here.
Senator Pan, University
Yes.
of California, here just to answer questions, and we're neither in support or opposed, so we're here available for questions.
Okay. Tweener. All right.
Tweeners.
Okay. If you're available for questions, I may have some for you later.
Okay, well, we'll stay close.
We'll see. Okay. Thank you. All right. Before we begin, yes. Is there another person at the microphone? Yes. Yes.
Don't mean to get in the way. I'm Maggie White with California State University. Just wanted to briefly say we currently have a pending position on the bill. I have been working with the author and her staff to address our concerns with the bill, which primarily involve implementation and ongoing costs. Excited to see possible amendments coming through from the committee analysis. Look forward to seeing those in print, and just want to express our thanks for the ongoing dialogue. Look forward to continuing it. Thank you.
Okay, so that's a tweener, right?
That's a tweener. Thank you.
All right. Opposition. All right, so opponent, you have two of you. All right, so you have up to 6 minutes. So thank you. Welcome.
Ryan Brackney, University of California.
Are you? Did you want to just express your support?
I'm opposed.
Okay. All right. We're waiting to hear from the witnesses who are speaking in opposition. You'll have an opportunity to express your opposition after their testimony. Thank you.
Okay, sure.
The interruption.
Good afternoon. My name is Mary Lee Schreider. I'm Executive Director of Right to Life of Kirk County and Political Advocacy Chair for Californians for Life. For the 2 years it took SB 320 to make its way through the California legislature, we were told the purpose of the bill was to ensure immediate access for pregnant students to medication abortion, ostensibly to limit time away from academic pursuits. The resurrected version we're here to talk about today, SB 24, is a copy of its predecessor, erroneous assertions and all. Committee hearings on SB 320 focused on students' alleged impediments to abortions and universities' related costs and liability concerns. However, at no time has anyone posed the most relevant question: is medication abortion the most effective method to meet SB 24's stated goals? Research and recommendations by recognized experts in obstetrics and gynecology strongly indicate it is not. In his veto message of SB 320, Governor Jerry Brown dismissed the bill as unnecessary, but he was only half right. Medication abortions on college campuses are not only unnecessary, they are contraindicated. My colleague here will speak further on that, but as I said, SB 24, like its predecessor, contains erroneous information and fails to address concerns expressed by both life advocates and the universities. Proponents of last year's SB 320 asserted that students seeking early pregnancy termination often face hours of travel from their campus, city, county, or even geographic region. This notion was so thoroughly debunked that in his veto message, Governor Brown cited the actual average distance between California state-funded universities and their nearest medical abortion providers of only 6 miles, yet somehow the erroneous language appears again in SB 24. You'll find additional examples of still unaddressed concerns on page 4 of the report you hopefully have before you. Our greatest concern with this bill is its indifference to the serious adverse effects associated with medication abortion use. Since approving mifepristone in 2000, the U.S. Food and Drug Administration reported more than 4,000 cases of serious adverse events associated with the drug. Of those, more than 1,000 women required hospitalizations, including 598 who experienced blood loss so severe they required transfusions. In a 2017 summary, the FDA also reports that 22 women have died after using the drug. Included in the report before you is a legal opinion of the potential liability and expense our universities will face if SB 24 is passed. In summary, the opinion finds there's no consideration in the bill for potential liability exposures and other expenses that clinics may incur should SB 24 become law. It also finds it's completely unnecessary to require medical procedures on college campuses that create significant risk of injury or even death. Committee, we respectfully urge you to vote no on SB 24.
Hello. My name is Monica Snyder, and I am one of the atheists who co-leads the group Secular Pro-Life. I earned my bachelor's from UC Berkeley in 2011 and my master's from UC Davis in 2017, and I'm here to talk very briefly about some concerns about SB 24. As Ms. Schreider indicated, SB 24 is not only unnecessary but also contraindicated. In Senator Leva's press release regarding this bill, she discussed the importance of timely reproductive health care and abortion care without delay, but it's unclear how SB 24 would accomplish these goals because medication abortion is not timely. Even if offered directly on campus, medication abortion is more time-consuming generally than off-campus surgical abortion. Surgical abortion typically requires a single appointment with no follow-up. Medication abortion usually requires a first appointment to receive mifepristone and misoprostol, and time set aside in the day or two after to endure the bleeding, cramping, nausea, and expulsion of the embryo, and then a follow-up appointment days or weeks later to ensure a complete abortion. The American College of Obstetrics and Gynecologists, an organization of over 58,000 OBGYNs, which supports abortion rights, explains that medication abortion, quote, takes longer to complete, requires more active patient participation, and is associated with higher reported rates of bleeding and cramping, end quote. If the medication abortion is unsuccessful, the woman will need to either endure the process again or receive surgical follow-up. And medication abortions are frequently unsuccessful. FDA guidelines state medication abortion can be offered up to 10 weeks into pregnancy, but the efficacy rate decreases as the pregnancy progresses. According to the American College of OBGYNs, medication abortion at 9 weeks have an efficacy rate as low as 85%, meaning that up to or more than 1 out of 7 women at that stage would need surgical follow-up. There is nothing timely about that process. Given how common it is for women who seek medication abortion to require surgical follow-up, FDA guidelines and California require that medication abortion providers, quote, must also be able to provide any necessary surgical intervention or have made arrangements for others to provide such care, end quote. So unless the university health centers start providing surgical abortion on site, they will need to partner often with the same facilities that the bill's sponsors suggest are too distant or inaccessible for this patient population. Given on average abortion providers are about 6 miles from our campus universities, the bill is unnecessary, but given the time-consuming nature of medication abortion, the bill seems contradictory. I respectfully request that the bill's sponsors give a more compelling rationale that would justify mandating that our universities take on these responsibilities, expenses, and liabilities. Thank you for your consideration.
Okay, thank you. I'll thank both sides for keeping the time. Witnesses in opposition, name, organization, and your position. Microphone.
Brian Brackney, UC Santa Barbara, class of 1980 in opposition. As to be, thank you.
Thank you.
J.P. Pritchard, Executive Director of Tulare King's Right to Life, representing thousands of people in those two counties. Strongly opposed.
Thank you.
Alexandra Snyder, Executive Director of Life Legal Defense Foundation, in opposition.
Thank you.
Rachel Herring, student at Cal State Long Beach, and representing us Students for Life in strong opposition.
Thank you.
Hi, my name is Tamika Bass, and I'm the current co-president of Students for Life at UC Berkeley, strongly opposing this bill.
Thank you.
I'm Camille Cisneros, Pacific Southwest Regional Coordinator with Students for Life, representing over 90 student groups in opposition of this bill. Thank you.
Thank you.
Jonathan Chavez, student at UC Berkeley, in strong opposition.
Thank you.
Teresa Bukovac, atheist, registered Democrat, founder of Pro-Life San Francisco, representing them today in strong opposition.
Thank you.
Rebecca Hagan, representing Sierra Pregnancy and Health. I, too, have utilized medication abortion, at least the first half, the RU46 abortion pill, and I'm in strong opposition to this bill. Thank you.
Thank you.
Carrie Wilcox, Executive Director for Sierra Pregnancy and Health, and I'm in opposition to this bill.
Thank you.
My name is Robert Bird, Social Media Coordinator for Pro-Life San Francisco, and I urge you to vote no on this bill.
Thank you.
John Girardi with Right to Life of Central California in Fresno on behalf of our thousands of supporters in opposition to this bill.
Thank you.
Julia Cuellar, part of Fresno State Students for Life, and I strongly oppose this bill.
Thank you.
Richard Morrison, Fresno State Student for Life, and I oppose this bill.
Thank you.
John Spiros, and I represent Students for Life. I strongly oppose this bill.
Thank you.
Clarence Lewis, St. Mary's Catholic Church in Vacaville, UC Davis grad. We're strong opposition of this bill.
Thank you.
Carly Heil with St. Mary's of Vacaville, Respect for Life. I oppose this bill.
Thank you.
Greg Burt with the California Family Council in opposition.
Thank you.
Hi, my name is Jessica Rojas. I'm a parenting student at Fresno State, and I oppose this bill.
Thank you.
Liz Juarez, I'm a recent Fresno State graduate, and I'm also a registered Democrat, and I'm an employee of Right to Life, and I strongly oppose this bill.
Thank you.
Anna Bach with Students for Life of America, representing 1,200 student groups nationally in opposition of this bill.
Thank you.
Ricky Silva from Gilroy, President of Students for Life at San Jose State, in opposition.
Thank you.
Gabby Lara, I'm Public Relations Officer of Students for Life San Jose State, and I'm strongly opposed to this bill.
Thank you.
Maria Jose Fernandez Flores with the California Catholic Conference in strong opposition.
Thank you.
Corinne Hand from UC Davis, and I oppose.
Thank you.
Wynette Sills, Director of Californians for Life, with members throughout our state, in strong opposition to this bill.
Thank you.
Jenny Shute from Bakersfield, who has a niece at Cal Poly, and I strongly oppose this bill.
Thank you.
Pam Francis with Bakersfield, California, Right to Life, in opposition.
Thank you.
Noelia Aguirre from Parlier, California, and I urge you all to vote no on this bill. Also a student from Fresno State.
Okay. Thank you.
Jonathan Keller, President of California Family Alliance. I just want to say thank you very much for the respectful dialogue, Chairman. Very much appreciate all of the discussion and respectfully request a no vote. Thank you.
Thank you.
Rosemary Antunes, hello. RN, 37 years, 24 years in labor and delivery, and 5 years as a college nurse, and 5 years doing limited OB ultrasound on first trimester patients. Take this bill out of here. This is a strong opposition to this bill based on all those years of experience. Any questions? Okay. I have a few for the persons who said that they could answer.
Okay, well, we're not taking, we have witnesses up here when we get questions. So this is so we're good. But thank you. Good seeing you again. Thank you. All right. Okay. So questions from committee members? No? Oh, did you have one?
Oh, yes.
Oh, Senator Grove. You have a question?
Yes, sir.
Okay, yes, Senator Grove.
Thank you, Mr. Chair. Thank you, Ms. Leyva, for answering the questions. So based on the information that was provided regarding the funding, I realize that there's private funding available, about $10.3 million, but after 2023, do you know how this funding is going to be implemented? If you do, can you let me know? If not, and if it's an ongoing thing, I need to know that as well. And then also, if you can answer in the same funding question, based on the information that the witness, I apologize, I don't remember your name, ma'am. Monica, that Monica provided about the data about follow-ups, about 1,000 people that would require surgical procedures afterwards. Is that going to be part of that funding? And if so, how is it going to continue into perpetuity, I guess?
Very good. Thank you for the question. I'll probably let Dr. Grossman answer the second question about the how often it is actually does not work. But in response to your question, SB 24 aims to provide private grants for the cost of each student health center to be ready for this service. But it is not prescriptive in how each student health center decides to fund it on an ongoing basis. This service should be provided and funded in the way that all other health services are paid for. Just because we're talking about abortion doesn't mean that it should be treated any differently than any other healthcare service provided at any of the healthcare centers. UCs already use the student insurance, and half of CSU's bill Medi-Cal for Family Pack. So this would be the same as what they're already doing.
Thank you.
You're welcome. Dr. Grossman?
Just briefly, in terms of how effective medication abortion is, it's about 95 to 98% effective. If you look at the labeling for mifeprex or mifepristone, it says about 2.5% of women who use this treatment up to 10 weeks will need to have an aspiration procedure. I mean, as a provider, I can say that usually when a patient uses her insurance, that she pays, I mean, the insurance covers all of the services, including in the case of needing an aspiration. Also in the cases when a patient self-pays for the procedure, she doesn't pay any more if she needs to have the aspiration procedure done.
I have two more questions, I apologize. Student health physicians or nurse practitioners that tend to work in these clinics or facilities that are on campus, it's my understanding based on data that they have little experience in judging gestational age. And this, based on your own testimony here today, that the gestational age or this pill that is taken needs to be taken between 8 to 10 weeks of gestation. In the author's own statement, most women don't know that they're pregnant for 4 to 5 weeks. That puts you at 4 to 5 weeks, and the pill has to be taken within 8 to 10 weeks. And so I guess my question is who's going to judge the gestational age? I know it's done by pelvic exam usually, or ultrasound, or their ultrasound facility or ultrasound equipment on these campuses. And who is it, an MD? Who's going to judge the gestational age of the baby?
Great question. Thank you very much. So each campus will be provided with $200,000 to get their health centers up and running. What we found when we first introduced this bill is that our health centers up and down the state at CSUs and UCs range from a little closet, and you go in and say, hello, here's an aspirin, Goodwill, and Godspeed, to full-blown, beautiful medical centers. So that's why we originally made the bill a 2-year bill, so we could make sure we had the funding so we could get every campus up and running, because each campus will need to have a sonogram machine. So that $200,000 that will be provided to each campus will be for that. Additionally, each system will be provided with $200,000, because what we heard is that they wanted to have some sort of a 24-hour hotline. So they will get that in addition to that. So physicians, both MDs and DOs, can administer this, nurse practitioners, certified midwives, and physician's assistants.
Thank you.
You're welcome.
Senator Mitchell, you're next.
Thank you very much, Mr. Chairman. And since this is the policy committee, not the fiscal committee, I'm going to focus my questions on the policy. I'm reading the opposition that was distributed to us today. One paper really focuses on abortion and its subsequent impact on mental and physical health. So I'm not going to address it because what's not up for debate today is the legality of abortion. It is still a constitutionally protected right, so I'm not going to address that. I am going to look at the college campus abortions checking an ideological box, the document that was just shared with all of us. And I think it goes to one of the opponents' points about referencing the former administration's veto message about, challenging whether or not, or making basically a judgment call about what they deemed an acceptable distance versus someone else. And what strikes me, when I look at the chart that was provided on page 4, all of the clinics they reference are Planned Parenthood clinics. Planned Parenthood clinics that are currently being challenged from the federal level in terms of their ability to continue to be Medi-Cal providers because of the new federal administration's gag rule and a number of things. So at any given moment, none of these clinics could be available to provide any service, much less abortion services. So I'm not sure if it's appropriate or fair to expect that these clinics will still be available. So absent that, what would your comments be in terms of me exercising my constitutionally protected right to an abortion if indeed these clinics themselves are no longer available? If your whole argument is geography. You follow me?
Yes, ma'am, I follow you.
All right.
I would say that, and this is something I would leave to people that has much more expertise in passing legislation, but it seems to me that it's very risky territory to pass legislation on potential future problems that have not occurred. And so whether it's about abortion or anything else, really, if the argument, and correct me if I'm misunderstanding you, but if the argument is that we should make sure our universities provide abortions in case abortion clinics that already exist cease to, then I think that goes well beyond the scope of this bill, especially since this bill has focused very clearly and carefully on how we are not providing surgical abortions, for example, which part of my argument was that would make more sense in terms of saving students time. And I think that it would be difficult to answer. I think it's difficult to answer for the kind of speculation you're talking about. I guess if it were me, I would look at all the providers, not just, because we know Planned Parenthood's not the only abortion provider.
I'm reading from your chart, and so your chart lists, the whole column lists Planned Parenthood providers who are within 6 miles.
Yes, ma'am, I agree. But I'm saying if we're going to talk about this hypothetical situation, then I would look at what legislation you think is going to prevent Planned Parenthood's providing abortion, if it applies to all the clinics we're talking about, and under that landscape, what it would mean for the constitutional right to abortion on college campuses. But I don't think that has much to do with what we're talking about today, because that has not occurred, and to my knowledge in California isn't likely to. So
that's a relief.
So I guess I would just say that I would have to see that situation and then consider the argument.
I appreciate that. And I only raised it because I'm reading the chart that was provided to me by the opposition, that an arbitrary notion that 6 miles was deemed acceptable. I think the fundamental point of the bill that is before us is that it should be a service available to students on their campus. I appreciate the previous administration opined that clinics were close enough, and the point I'm raising is, and I think it is a very troubling but potential likelihood based on the current consistent action of the federal government that these clinics would not be able to provide the services that we're talking about today. That has been a consistent attack and message from the administration. We are currently fighting a Title X gag order. And so I appreciate your perspective that California wouldn't be in that category. hope to share your optimism, but I'm very concerned. But I just think if that's the argument you're going to raise, that we need to be really clear about what is on the table, and we introduce legislation on a regular basis, including the budget, in terms of our expectations about prospective actions. We do it all the time, so that's clearly within our lane.
Is it okay if I respond?
Only if, through the chair.
Sure.
Do you wish to respond?
Yes, thank you.
Yes, please.
The only other thought I had is that it's not, I think it's inherently in the end going to be a matter of opinion deciding what is or is not an acceptable distance, and that's up for debate, I agree. But I don't think the argument is solely what is an acceptable distance. This isn't a situation of infinite time and resources, and I think part of the argument, and this is not speaking to pro-life or pro-choice at all in my opinion, it's simply we're going to require the universities to take on something that they haven't elected to try to do on their own, and if we're going to do that, and it's going to cost some non-zero amount, a very large non-zero amount of training and expenses and resources, then there has to be a balance of consideration. So for example, if, let's say, the nearest abortion clinic was on average 30 miles away, then we might start to be more like, well, that's very strongly in the argument that you're making. Or if it was on average a block away, then it would seem less compelling. So I think it does matter to look at average distance and look at what the bill is going to cost, what liabilities it might open the universities up to or not. It's worth discussing. But it's not simply one side of the equation, because if this was solely about the constitutional right to an abortion no matter what the cost, then I agree there would be no point in looking at the geography, if that makes sense. But it is always going to, well, it's always going to be a balance of resources. And that was part of I think that was the part of the thought process when it was vetoed.
I appreciate that. And this is the policy committee. The resource conversation takes place in the appropriations committee. So I'm really focused on the integrity of the policy itself. Another witness wanted to respond to my points through the chair, if that's okay with you, Mr. Chair. Thank you.
Please.
Yeah, I just, regardless of distance or anything like that, the fact of the matter is this bill is about access and access to my rights. And in that 3-month period that I did not have access to my rights, I had no rights, essentially. So this is about access. Regardless of whether it's 6 miles, 10 miles, 30 miles, it should be accessible to anyone, no matter the distance, and make it closer and make it more central to where students' lives are at.
Okay, thank you.
Thank you, Mr. Chair.
Okay, thank you, Senator Mitchell. Senator Stone.
Thank you, Mr. Chair. And first, I want to thank all the people that came here to speak on this issue today, especially all of our youngsters. This is an important lesson in democracy and seeing how we can collegiately discuss issues that we agree with, issues that we disagree with. And so I want to applaud you all for taking the time to be here today. Mr. Chair, I'm going to talk about 2 things, and we did have a representative from the UC here. While I'm giving some concerns, if she can make her way up, I'd like to ask her a question.
Yes, if you want, please come to the table.
So my concerns are 2. The first is safety concerns, and the second is liability. The proponents claim that abortion medication techniques are extremely safe, highly effective, and cost-effective. And maybe for most women that's true, but for many, this is not the case. Student health care centers are generally not equipped to handle medical emergencies that come with the adverse reactions that come from abortion pills. Since mifepristone was approved in 2000 by the FDA, as was mentioned, there have been more than 4,000 cases where severe reactions have occurred, including 1,000 women that have been hospitalized and 598 women that have needed blood transfusions because of profuse bleeding. And unfortunately, there have been 22 deaths directly attributable to the medical procedure. The New England Journal of Medicine in 1998 concluded that 1 out of 6 cases, the termination of pregnancy when the medication is taken is incomplete. So when the abortion pill doesn't work the first time, a lot of times we've heard about that. There's a delay before the woman understands that has not been effective, which means that she's often having to take it a second time, which is pushing against the 10-week window. And the risks to the mother are much greater since the elapsed time between her taking the pill and the surgical abortion that may be needed has allowed that baby to mature even to a further extent, maybe causing more complications. If the medication abortion fails to terminate the pregnancy, the time commitment and costs rise even further as the patient needs another round of medication abortion, or if too late, a surgical abortion. If the medical abortion doesn't work after 10 weeks, the woman will have to utilize a surgical abortion. Second trimester surgical abortions procedures are significantly more expensive and carry a much greater overall risk to the mother. These risks include heavy bleeding, cramping, and nausea. And a lot of young women that are here, college-bound women, often lived in dormitories, often in communal situations and apartments where bedrooms are not private. Housing is expensive. You have roommates. Abortion is a highly personal decision that must be made by a woman, and there is ample availability to abortion options through organizations like Planned Parenthood and qualified medical professionals. Having campuses provide the abortion pill gives a false sense of security to young college women that are seeking an abortion. And so for my UC colleague, thank you very much for being here today. What do you see as potential liability for your campuses if the abortion pill is unsuccessful and complications arise that can't be mitigated, if you will, with your on-campus clinic, where your patients may have to go to a hospital, surgery center to maybe even save their life?
Well, Senator Stone, thank you for your question. Yep. And I want to back up a little bit in my haste to say I was a tweener. I did not introduce myself, and I want to do that now. My name is Angela Gilliard. I'm the Director of State Health Policy for the University of California Health System. The university does not have a position on the bill. We have been working with the author, and I think very effectively, and as we move forward, we want to continue to have those conversations. To answer your question, I know it might seem odd, but I think it's a little bit beyond the scope of this bill, and I'll tell you why. A student now can go in the community and get this service done and still have to go back to her dorm room and still might have those side effects. Now, while I'm not prepared to talk about the numbers of the side effects and so forth, wherever she gets this medication, if there is going to be a side effect or a bad side effect, she is going to face the same issue. Right. And so if it's an emergency, it's going to be an emergency whether or not the university health system administers the first pill or whether it's done 2 miles away. So while I'm not prepared to comment on it, I do feel if we look at it from the perspective of women are getting this outside of the student health centers and going back on campus now, it's not going to be addressed by this bill.
I don't disagree with you, but when you have a woman that's going on to a campus facility and they're beginning and initiating a medical treatment that has complications, and those complications in instances, albeit rare, can be the life of the woman or hospitalization to mitigate hemorrhaging, I believe that there can be liability on the campus that initiated that treatment. So you've answered the question, and I appreciate that. My concern about the liability of college campuses remains, and I'm hoping that the author will work throughout the process, assuming the bill gets out, which I'm sure it probably will, because this could be a lot of exposure. The lives of young women who may face severe complications is also a major concern of mine. The health and safety of women on our college campuses needs to be taken seriously, and giving them a false sense of security with an easy fix to their abortion needs doesn't seem like a wise course of action to take. So for those reasons, I'm not going to be able to support the bill today. Thank you, Mr. Chair.
Thank you. Other questions or comments from committee members? Senator Mitchell.
Thank you. I think the question of liability is a fascinating one. Ms. Gilliard, could you educate those of us who've not been on a college campus in recent decades about... Well, I was referring to myself, but...
I thought you were referring to me.
But since you called them youngsters and they're young adults, that makes me, I could adjust mine. But help me understand the kind of range of medical services that are currently provided, and if you could speak globally so the CSU representative doesn't have to come forward, because as we talk about liability, I'm wondering how you handle liability on any of the services that you provide on campus.
So it's a good question, Senator Mitchell. The university is self-insured, so for liability, it is a direct cost to the university, up to $5 million, over $5 million. We have umbrella insurance.
I apologize. I'm going to ask you to try to speak into the microphone.
Yeah,
Senator Mitchell's behind you, but for the record, yes.
It's okay.
So the liability, well, currently the services provided at the student health centers range depending upon the location and the how the student health center is staffed. The university doesn't staff all University of California health centers the same. They each have their own local ability to decide which expertise exists at their center, what services they'll provide. There's some things that are common across the system. But I would say if in the event of liability, and it is an interesting question, if even one case in 3 years, for example, or one case in 5 years could be expensive to the university. We have not provided a risk assessment as part of our analysis, but I don't think it's zero, but I don't know the amount, and I don't know with the frequency and the statistics. It could be 1 in 10 years, or it could be never. I just don't have that expertise or analysis in front of me.
But if I may, through the chair, but my question is to remind me of the nature of the services currently applied, offered. I'm clear that they range, as in any healthcare facility, based on geography, whatever, but just give me a sense of what they are.
So in terms of, there's reproductive services, so birth control, there's some IUD implantation at some of the student health centers. There's STD testing. There's a variety depending upon the location. So there's optometry services. There's primary care services at each student health center. There's 24-hour nurse availability at each, and there's I think a fairly robust mental health service available at each student health center. So beyond that, those are the core services, and there will be some specialty at various different places.
I know you're a tweener. And I don't know the nature of kind of your discussions, but I'm curious from the university's perspective if this service is outside of the realm of the kinds of service that are currently offered in terms of the medical intricacies, for the lack of a better term, in terms of what you currently provide.
So I think that's a good question, Senator, because we're a tweener, but we're not a tweener when it comes to reproductive rights and women's rights to choose. So we have student health insurance that provides the insurance that allows a woman to go to community providers and have that insurance covered. I think what happens as a matter of calculation at each student health center, they decide which services as a matter of cost they should take in-house and which are available or potentially available by local physicians and or clinics. So this assessment is really around cost more so than ideology.
Mm-hmm. Mm-hmm. And thank you very much. And so, Mr. Chair, let me say that I'll be supporting the bill today. What I am most interested in is really kind of the how it's operationalized, how we, in a system that's not consistent, that whole piece. The argument about whether or not one is anti-choice or pro-choice is moot to me in the context of this bill. For those who don't believe in abortions, don't have one. And so the conversation about whether or not I should have full, complete access to whatever reproductive health services I deem appropriate for me should be left up to me. Again, from my perspective, that's not the issue here. Unfortunately, that's what much of the opposition is focused on, which is often the case when we have this discussion. So we're not debating my right to choose. Again, I'm going to support the bill, and I do think it's important that we figure out the way in which it makes sense for the system in which we are asking provide access to the otherwise legal and available medication. I think it is unfair when we have these discussions that we focus exclusively or very narrowly on complications. As you know, Mr. Chair, I'm carrying a bill that is acknowledging the reality of the disproportionately high rate of African American maternal morbidity in this state. So we deny the reality of the dangers that carrying a baby to term, that they exist. So if we're going to talk about, statistics and risks, then we should present the full spectrum, because there are risks associated on both ends of the spectrum. But again, I'll be supporting the bill today. Thank you.
Okay. Senator Grove.
Thank you. I'd like to thank my colleague from Los Angeles for that line of questioning, because it brought something to light. So since we do have the representative from the university here, I have a question about these normal scopes of operations that take place right now in these medical facilities, reproductive health, IUD implant, STD testing, I'm assuming pregnancy testing under these issues. That you didn't mention that, but just out of curiosity, do those, and I realize you're not a medical expert, but do those in your position that you have at the university, let me approach it a different way. As a business owner, I know that if I do X, it creates a certain liability. I know if I provide staffing, right? If I staff somebody in a clerical office, I have this piece of liability. There's a chance they'll get injured. Not really. If I put a roofer on a roof, there's a higher risk of liability. Do you see that this bill and implementing this bill on a university campus, is it the same liability exposure, or do you see it as a higher or lower or liability exposure?
This bill this concept has been looked at for a couple of years, and we just have not heard a lot of ringing from the university, and we're not a quiet group typically. But about the liability, that doesn't mean that there's none, but there hasn't been, as part of our analysis, raising that. It really has been a matter of student health centers are not hospitals, and so how do they manage their budgets, and how do they determine which services are better off or on was not necessarily a decision about liability. It was more of a decision about, we refer other services off campus as well. So we don't have all services in the student health center, because the goal of the student health center is to have as low or no cost as possible. So wherever we can find a community provider, we do, and whenever we can do it in-house, we do. So it really is very much a local decision, and the decision hasn't been, let's look at the strands of liability and decide this versus that. So that's not been, to my knowledge, the way the decisions on bringing services on or off have been made.
But I'm asking you, as somebody that represents a university, if this bill goes, or when, I guess I should say, this bill goes forward, and you're mandated, and the universities are mandated to provide this service, does it create a greater risk of your $5 million of self-funded insurance before it goes out to reinsurance? Or is it just as simple as giving somebody a stick to urinate on to see if they're pregnant?
I don't know. I don't know. I think it will depend on the risk is about numbers. It's about how many potential cases and the like. So and So I really don't know. I don't want to. I would be happy to follow up with you after the hearing because I don't know the exact answer to your question.
Maybe I could ask it in a different way, and I'm not trying to badger you. I really am not. I'm just trying to come to a conclusion, or maybe, Rebecca, if you have, sorry, Monica, I apologize. I should have written your name down. I guess I'm not asking it right, and I apologize. I mean, I apologize for not asking it right. I guess if the student medical facility on campus was issuing a pregnancy test, and whether it's, I don't know how you do it anymore, EPT, I don't know, right? I don't know. I'm not, I didn't go to college, so far from my colleagues that have been out for a long time, I didn't go. So I don't know what's there and available on school campuses. And so I guess my question is if someone comes in and says, I want this test administered to see if I am pregnant, and then they take a pregnancy test, what's the risk or liability for issuing that pregnancy test? Like, is there a risk of bleeding? Is there a risk of post-surgical? Do you understand?
I understand your question a little bit better now.
Okay, good.
So we routinely test for pregnancy. We have hundreds of tests that are performed monthly, and we routinely counsel once a test has been if it's a positive test, we counsel on various options and so forth. So that's a very low threshold, I would say, kind of service that's routinely provided by every student health center in terms of the pregnancy testing.
Do you see that? Do you see that provide service that you provide an impact to your $5 million of unfunded or funded self-funded liability?
I haven't heard that. Performing pregnancy tests have lifted, have caused any kind of...
Being mandated to put this bill on the State University campus, do you think there's going to be a risk to your $5 million of pre-funded, more of a risk?
So I am a little confused because we're already doing pregnancy tests. That won't change. This bill doesn't mandate that.
It's not the question. It's the bill is mandating you to provide a pill that terminates a pregnancy, which could in some cases cause bleeding, cramping, surgical procedures that are needed. Does that create a greater risk of liability to your self-funding mechanism and therefore your reinsurance mechanism if someone, I don't know, Senator Stone quoted the numbers, and I didn't write them down again, and my memory's just not.
I think there's maybe a potential, but I would have to speak with some experts about risk assessment and liability to the university.
Thank you, ma'am.
Okay. Before we move on, someone who's actually a physician who actually works in, so I appreciate the back and forth. And I want, and Senator also, please, I apologize. I want to be sure we get to your question too. I guess I hear the conversation, and certainly I think, as you said, there's anytime you do some procedure, there's obviously unique, but I think we need to see how and so we had dialogue with Senator Mitchell, and I appreciate Senator Grove what you also brought up. You're going to. I understand. So first of all, I understand UC and CSU, I know you're standing back there, are in conversations with the author, correct? All right. And this is not the first time this bill's come before. And what I heard, correct me if you're wrong, if I'm wrong, that in many ways, at least, let's put it this way, in previous iteration of the bills, the liability was not an issue that rose to the point where people, I know there's lots of attorneys at UC, because I was a faculty member there, who came back and said, oh, by the way, we're really worried about the liability. I mean, there may be other issues people are worried about. Okay. I just want to put that on the table because this isn't the first time this bill's been before the legislature, and UC has been, and I assume CSU has also looked at the bill, and they're looking at the different issues and that may come from, and I understand your tweeners because there are some issues. But I know there's a lot of focus on the liability piece, but what I heard you say, just to clarify, is that people are at least, and it's not going to be zero, as you said, but it's not like the big thing that everyone's worried about.
Well, from the UC perspective, I can't speak for CSU.
Right. No, I know. I'm not expecting you to speak for USCSU. That's why I heard you say for UC. Okay. And does CSU have a different thing or not? Okay, come up, but and keep it very brief because I want to be sure Senator Durazo. But I just want to clarify this point because we seem to have gone around a few times about that. So if I can ask you to give like a one-sentence answer to that, like yes or no.
I would say liability is a concern for anything. It is not our greatest concern with this bill. We had a conversation with the author, and we're thankful for that.
Okay, got it. All right, because yes, the answer is greater than 0, but not so big that that's the main thing. All right, Senator Durazo.
You know, the way you describe it, there's so many medical services, even if they're not identical at every center, I assume, depending on what's more needed or whatever they decide at that campus. You know, I would hate to see looking at women's reproductive services as a greater risk, or seeing reproductive services under a magnifying glass versus all the other many services that are provided. And I'm sure, being medical services, that there are always risks and liabilities attached to that. So I just, you know, I hope this isn't, you know, a way to create more obstacles for women's reproductive services, that women face enough obstacles as it is. And I would really like to judge this on the fact that we're protecting the reproductive rights and the reproductive services, not looking for a way that's going to get in the way of those rights. Thank you.
Okay, thank you. All right, seeing no other questions, I'm sorry, I'm blanking on your name again. Jesse. And first of all, thank you so much for being here and sharing a very personal story. And you don't have to answer this if you don't want to, but you mentioned it took you 3 months, right? And, you know, we've heard about 6 miles, X miles, whatever. Do you mind sharing with us why did it take 3 months? I mean, what happened to the degree that you wish to share that with us? I know it's very personal.
Yeah, sure. So the fact of the matter is that I got pregnant and I went to my student health center where they told me that I was pregnant. I was a graduate, or I am a graduate of UC Riverside. So at the UC Student Health Center, they then set up another appointment with an OB-GYN, where that OB-GYN told me about 3 different places I could go to, so 3 different referrals. The first facility that I was sent to didn't offer abortion services, and so that delayed a lot of my care. The second facility that I was then referred to then told me I was able to schedule my appointment there, but afterward they, after dealing with that, they said that they could give me an appointment about a month and a half out from that time that I called. And as you all have mentioned, having an abortion is a deeply personal decision, but once someone has made that decision, they're going to do it. And so I waited. I said, at least I have the appointment ready. From there, about a week before my appointment, they call me and they deny my insurance, claiming that I wasn't on the student health insurance plan and that I was actually on Cal Optima, claiming that I had to go back home in Orange County, which is an hour away from UC Riverside, without a car. And, we talk about barriers. I wasn't ready to tell my parents about this either. So one important thing to remember here, as you discuss young people, our rights and our barriers, or our barriers to our rights, are exacerbated because we are younger people. So from there, I couldn't get my appointment, and bringing up another barrier, the stigma. As you mentioned, Senator Durazo, putting our reproductive health care under this magnifying glass. I had remained silent throughout this whole time, and then finally broke my silence when I finally went to a Planned Parenthood, because I opened up and I told someone about it. But so that in a nutshell is what happened.
Okay, I hear a motion for the bill. So thank you so much for sharing. Actually, Senator Leyva, it sounds like one of the issues, so aside from lack of availability on campus is also, and frankly, I could ask you the question, but I know what the answer is that any facility, including student health facility, should also have relationships with other providers. Although in this case, what I hear is that they referred you to a person that wasn't able to provide the service. So it sounds like we need some improvements there too. And I know that UC also operates lots of medical centers as well, since I used to practice at one. Did you want to say something?
Yes, if I may, Senator, just briefly, this has been a very important conversation, I think, for the past year or so on this issue. And one of the results of having this issue was to recognize that student health centers, and we have directed our student health centers to make sure that their lists are accurate, and to not just refer, but to do more of a warm handoff to make sure that the student gets the appointment that because this is not the kind of thing you give them a sheet of paper and say go and do. And even if this bill passes, it doesn't ensure that every student is going to want to have the procedure there on the student health campus. So we still need, I think, from the university's perspective, to provide that service of a more warm handoff, so you're not 3 months trying to figure out insurance and is this the right provider and does it work? And that was, and Medi-Cal's a whole nother issue because Cal Optima and
right. Well, you're signed up at your home county. Okay.
Yes. So.
Got it. Okay. So I think the point's well made. I think we see a lot of the challenges. I think Senator Leyva is offering a solution. I hear a motion. Senator Leyva, would you like to close?
Would like to close. Thank you so much, Dr. Pan. Thank you to all of the members for your testimony. It's greatly appreciated. There's two things that I would like to address. One, we heard from the opposition about access. Currently, 22 UC and CSU campuses are more than 30 minutes away from the closest abortion provider. And I would also say that if you read all of my rebuttals after we received that veto message from the governor, I vehemently and strongly disagreed with his assertion that he did not think it was inconvenient. So that may have been his veto message. I certainly did not think that it was appropriate, nor did many of the supporters. Second, I wanted to talk a little bit about liability. Fortunately or unfortunately, we live in a very litigious society. And if we are going to worry about what could happen, which I do think that's a legitimate concern, what happens at a USC right now who treats a student with diabetes and the student goes into a diabetic coma? Is the UC or the CSU liable? What happens when they're treating someone for mental illness and they try to harm themselves? Is the UC or the CSU liable? When my daughters were in college, their freshman year, one of their teammates stumbled into their room so drunk that she wet herself and passed out. My girls called me and I said, "Dear God, hang up and call 911," which they did. And later, the mother of the student tried to sue us because she lost her scholarship and tried to sue the college. So I think that we can't always worry about liability. It's always going to be there. It's unfortunately the world that we live in. But I will end with this. When I got elected and came to Sacramento, I found out very quickly that I had kind of been raised in and lived in a bubble. I lived in this very warm environment where my parents talked to me about my rights, where I knew that a woman had the right to have an abortion, that we could talk about it, and there was no shame. And then I got here, and I was just absolutely dumbfounded, and this hasn't happened today, but dumbfounded by how the opposition shamed women for accessing their constitutional right, how women feel stigmatized. And so I said to myself, I said, you know what, I don't want that to happen anymore. People didn't even want to say the word abortion. It's like, abortion. You know what? It is part of life. Every woman has a constitutional right to access. It is your body. You have the right to decide. No one else has that right. So for me, this is personal in the sense that I grew up in a household where we could hear the word abortion. We could talk about my fundamental rights as a woman. And now, as a legislator, I think it is my job to try and help make sure that every woman has that choice. This bill does not mandate anyone has an abortion. This bill says that women have a right and they have a choice and that it should be easily accessible. And with that, I respectfully ask for an aye vote.
Okay, thank you. So the motions do pass as amended to education, and it's been moved by Senator Mitchell. Secretary, please call the roll.
Pan?
Aye.
Pan, aye. Stone? No. Stone, no. Durazo? Aye. Durazo, aye. Grove? No. Grove, no. Hurtado? Aye. Hurtado, aye. Leyva?
Aye.
Leyva, aye. Mitchell? Aye. Mitchell, aye. Monning? Rubio? Rubio, aye.
Thank you, Mr. Chair. Thank you, members.
The bill is 6-2. We're going to hold the roll open for absent members. Thank you.